Hello, students. Can you hear me, students? I think we have only one student at the moment.
Yes, I can hear you. Afternoon.
Good afternoon.
Yes.
Right. And can you see the screen which I have shared?
Yes, I can see it.
Right, right. Perfect. So uh, I'll start and first I'll give you my introduction then and to let you everyone know that I have started the recording as well. So it would be available like via the YouTube or any other sources which college shares with all of you. So my name is Sayyed Taj, and I've been teaching uh, different subjects, business management, healthcare, educational subjects like DET, AET, CET, something like that. Since many years, like I've been into teaching since 2007, and I'm working with different colleges part time, and I will be teaching you this unit, and this is related with the health and social care context and principles. So uh, I will start today's lesson then. So uh, like today we are going to explore the context and the principles of health and social care, and this is a crucial foundation for anyone entering the field, and because it helps us understand the environment we will be working in, and the values that guide our practice. So basically health, social care, and social work, all three are different. um, so we'll explore everything, but this subject is related with the health and social care and its context and principles. So, like with all of the units, we usually have four learning outcomes in any unit. So, the first unit, with that, we have the first learning outcome. Is the learning outcome one is the understand the organization of health and social care within a national context. So we will be discussing about the organization which deals with the health and social care and as a national context. For example, we are here in United Kingdom, so we will discuss about the uh, context of and the principles which in the United Kingdom we follow. Uh, and in the meantime, if you have any questions, so you can ask me. So I'll try to answer that as well. So uh, now I'll begin. Like the first bit is the context of health and social care. So, like for example, if we say about health and social care, uh, we can say that health and social care is a broad field and which has many aspects. Um, so, as you were saying that it has healthcare is different, social care is different, and social work is different. All are different fields, but they all lie in the health and social care and social work sector. So, what we can say about it as this field has various service and intervention designed to improve the physical, mental, and social well-being of individuals and communities. It includes hospitals, care homes, community health services, and social work, among others. So, may I ask that do you have any idea, or can you give an example of how health and social care service might work together to support an individual? Are you working in the care industry, health and care industry?
Yes, I'm working with ATHE Care in Home.
Right, good. So you have the idea, like we can say that example of health and social care service might work together. So it's like a person with a chronic illness might receive medical treatment from a healthcare professional in a hospital, while like a social care service provide support for daily living activities at home. So you will be so that includes into that. And again, if we are working as a social workers, so then the social worker provides then the social help. So there are some principles of health and social care. There are several key principles which underlies in the health and social care practice. For example, we can say that empathy and compassion. And what does empathy and compassion mean? Understanding and sharing the feeling of others and showing kindness and care in our actions. So, like as a person, every individual have these values and qualities in them. But in health and social care, we always follow these important points. Then we have, for example, respect for dignity. So, what is respect for dignity is treating everyone with dignity and recognizing their worth and right as an individual person. Then, of course, as we are in a profession where we follow the professionalism as well. So, in professionalism, we maintain high standards of conduct and competence and accountability as well. We are accountable for our actions. And one more important thing is confidentiality. So, confidentiality is very important, and we always take consent of the service user or the patient or the client, whatever we say, we are serving them. So in confidentiality, what we do is we respect the privacy of the individual and keeping their information secure. Like for every recorded thing that like we need to think about the data protection and the GDPR. So when we save the information, we follow these, and we have equality and diversity as well. And what is equality and diversity? It's promoting equal opportunities and respecting diversity, ensuring that everyone has access to care regardless of their background. And then we have safeguarding. So in safeguarding, what we do is protecting the vulnerable individual from harm, abuse, and neglect. It's not necessary that it's for children or adult only, like it's for everyone. It's our duty to safeguard everyone, including ourselves as well. So we follow these bits as well. And like as I said before, that confidentiality is very important in health and social care. So why it is important? Because uh, it's a building block. Like it builds trust with client, service user, and respecting their privacy and ensuring that the personal information is protected. Then in health and social care context and principle, um, we are bound with ethical and legal frameworks wherever we work in health and social care industry, or even any other job. We are bound with some legal and ethical frameworks which we always have to follow. Just for example, in health and social practice is also guided by legal and ethical framework that set out the rights of individual and the responsibilities of professional. There are some legislation in health and social care, like for example, health and social care act. Now it's changed to, I believe, in 2022 health and care act. For example, we have the mental health act, then we have the equality act, and as well as code of ethics and professional standards. Plus we have internal policies, organizational policies. We have like the country specific policies which we need to follow. And for example, if we think about an ethical dilemma that a health and social care professional could face, so just for example, a professional might encounter an ethical dilemma when there is a conflict between respecting a client privacy or any detail of them and acting in their best interest, such as when a client refuses life-saving treatment, or every uh, service user has different needs, so we make the care plan and we always uh, follow their cultural or religious aspects as well. Uh, this is generally we do in health and social care, and this is generally about the topic. Then if we go to the next slide. Now, okay, here we have the unit aim. So whatever unit we'll study, we have some aims to follow in that. And for example, in this unit, the aim is to develop an understanding of national, legal, and ethical context of health and social care with a focus on adult social care. Okay, so the main focus is on the adult social care. Learner will examine the values underpinning code and the behaviors and responsibilities working in the adult care sector. So basically, mainly we are focusing on the adult care industry in that unit. Right. So what other? Then this is about the indicative content. Right. So here, as in the bullet point is mentioned, that health and social care provision in a country of choice to cover organization funding and the size of sector, example, statutory, voluntary, private, and informal provision, like NHS in the UK or other public provision, strategic health authorities, primary care trust, and NHS trust or similar outside of UK. Okay. So as I said earlier, that we will be discussing about the United Kingdom, and in the United Kingdom we have the NHS. And for example, similarly, it would be different with any other country if the students are living somewhere else. But the assignment structure or the guidelines which would be provided, and the assignment, I think we need to make according to the health and social care industry principles and the context we follow in the United Kingdom. So it has these bullet points, and for example, split between public, private, voluntary provision. Okay, now this is important. Like for example, here we can say that what is public provision, for example. So public provision is services funded and provided by the government. Example could be social services department and publicly funded care homes. So then if we talk about the private provision, what are private provision? It's services offered by private companies, which are often funded by service user or through insurance as well. And the example could be the private nursing home and care home agencies. Then we have voluntary provision. So the voluntary provision service is provided by a non-profit organization or charities, and this is often supported by donation and grants, and there could be some support group and community-based care services also available for the service user. Then, for example, uh, organization with adult social care. What are those? Uh, Government department, such as the Department of Health and Social Care, and what they do is they set policies and standard for care services. Then we have some sources for funding, and that could include government funding, private payment, insurances, and charitable donation as well. Then we have adult social care providers, so organization that usually deliver care services such as residential care homes or care home agencies and day centers. And we have the domiciliary care as well in that. And uh, now we have roles within adult social care, residential care. So in that, if we talk about the residential care, so usually care workers provide support with daily activities. We take the personal care and social activities in a care home setting. Then we have home care, for example. Care worker assist individual in their own home with tasks like cooking, cleaning, and personal care as well. Then we have another bit, that is nursing care home. So the nurses provide medical care and support, like in care homes, focusing on an individual with complex health need. So, for example, in that, if we say that what are the main differences between public and private adult and social care provision? So the public provision is funded and provided by the government, while the private provision is offered by private companies and often funded by service user or insurances. Then we can say that, for example, uh, mm, what would be the role of a person within health and social care, adult social care, and what could be the responsibility of a person working in that field. So we can say that a care worker in residential care has the responsibility of providing personal care and support with daily activities to residents. So we sometimes call a care worker healthcare assistant. So usually they do the work in adult health and social care industries, and these are few of the responsibilities of them. So now, how do adult social care providers relate to service user? So what they do is they provide essential care and support services tailored to the individual needs of service user, enhancing their quality of life. So generally, whenever we deal with a service user, we have that care plan with us. So we act accordingly to the care plan which is provided by the management, and then we deal with it. So that's the next slide. Terminology. Let's watch a video. Okay, it's related to the video, but I believe that the video is missing from here. So hopefully you will get those slides as well separately, and that might have the link. And now we are on the slide 7. So it's now asking about the explain the structure of health and social care provision in a chosen national context. So again, we will talk about the United Kingdom, and generally, we will explore the structure of health and social care provision in the UK. So if we break it down, so then there are few key components of it. For example, the first one is the National Health Services. So the National Health Services, the NHS, is the publicly funded healthcare system in the United Kingdom. What it does, it provides a wide range of health services, including general practitioner, like we call them the GP here, GP services, hospital care, mental health services, and emergency care. These are the sort of services provided by the National Health Services to the residents of the United Kingdom. Then we have, if we say that, uh, social care services. So again, these are also provided by local authorities, and we have that again, as well as the hospitals or the medical treatment or even the social care services. They are privately funded and funded by the government as well. So in the social care services, we have care homes, residential care, and support which support with the daily living activities. So as I said that there are some private organizations as well that work in the healthcare industry or social care industry. So we may have some hospitals, private hospital, clinics, and care home, and these are funded by the private insurance or from the service user pocket. Then we have a voluntary sector. So with the voluntary sector, uh, right, okay, yes. So we have the voluntary sector. So in the voluntary sector, charities and non-profit organizations also play a role in health and social care, providing services like support group counseling and domestic help as well. So uh, if we say that what are the main differences between NHS and private healthcare providers in the United Kingdom, the main difference is NHS is publicly funded and supported by the government, and the services free at the point of use, and the private healthcare providers are funded through private insurance or direct payment and typically offer faster services or more choices. And if I say that example of a social care service provided by local authorities, it's care home and care workers which assist individual in their own home. We may help with the personal care, cooking and cleaning. So then if we say that how the voluntary sector and organization contribute to health and social care in the UK, so they provide additional support services such as counseling support, support groups, and focusing on the specific needs or condition. So these are the bits related with this one. So again, we have those um, private. I've discussed about that, and essentially voluntary and private provision. Then we have secondary healthcare. Okay, so for example, if we discuss about the secondary healthcare, so what secondary healthcare includes is a specialized medical service that are provided by the specialist and the hospital. These may include services such as surgery, diagnostic test, and specialist consultation. So, in the primary care, we go to the GP, and in the secondary health care, if there is something serious, then we like get in contact with the hospital. There could involve some surgery or test or some specialist consultation. So that is in the secondary health care. Then we have the integrated care. So, what integrated care is refers to a coordinated approach to healthcare delivery that aims to improve patient outcome and experiences by ensuring seamless transition between different healthcare providers and settings. And right, okay, this may involve collaboration between primary care, secondary care, social care, and other support services. So we have multi-agency or multidisciplinary care working in that. So as the students, all most of you are in the health and social care industry already, so you know that we work as a team. We follow the multidisciplinary team approach, and we do that. We get in contact with the GP, nurses, or like dentist or therapist, physiotherapist, and something like that. So we do that integrated care. And for example, if we discuss about now the mental health trust and children trust, so we have the mental health trust and the children trust in the United Kingdom. And as its name, like mental health trust would deal with the mental health issues, and the children trust is for the children and their families, which provide them the social care, education, and health services. Now, what we have. Okay. So this is generally about, in conclusion, what we have discussed so far. So that the understanding the structure of health and social care provision in a chosen national context, and we provide the insight into various organizations, services, and resources available to meet the diverse needs of the population. So what we have, okay, in the next slide we have analyzed the organization providing adult social care and how these are assessed by the service user. Okay, so we need to analyze organizations. Okay, so for example, in the slide, they have mentioned government departments and local authorities. So, for example, if we discuss about this one, so local authorities. So these are the primary providers of adult social care services. They assess individual needs and provide services such as again home care, daycare center, and residential care. Uh, uh, then, if we talk about the private sector, so again, many care service provided by private companies, and we discussed it earlier that there are some home care agencies, nursing home, which are privately funded. And then voluntary sector, again, we have discussed about it that some charities and non-profit organization offer additional support to the individual. Then government department, if we say that, so while uh, we have primarily in healthcare in England, we have NHS. So like NHS also provides some social care services, particularly for the individual with complex health and social care needs, and like those who have having continuing healthcare needs. So NHS provide that as well. And now, if we say that um, when we provide a service, so we do the needs assessment as well. Like when we have a care plan, before that we do the need assessment as well. The first step for assessing adult social care service is usually needs assessment conducted by a local authority, because we are talking about the services provided by the organization which in the United Kingdom. So generally, what happened? We do the need assessment, and then after taking the assessment of the needs, then we make the care plan based on the assessment. Care plan is developed outlining the services that will be provided, and then we have funding. Um, can you please mute your mic? Uh, so then we have the funding. So services may be funded by the local authority, self-fund or self-funded by the service user, or a combination of both. It could be both as well. So then if we say that what is the role of local authority in providing adult social care? So it could be the assessment of need, arranging some services, and provide funding for adult social care. And for example, uh, how might a service user access home care from a private care home? So, like we can have it through self-funding, and like if we apply for the local grants from any local authority, so if we are eligible, then we would get some funding, or the service user could do both ways, like part of the payment they will pay from their own pocket, and part of the payment is paid by the government or the local authority. And because like we discussed that um, uh, need assessment is like really important. First of all, we try to figure out what are the needs of the service user, so then according to that we make the care plan and we try to help that individual. So here, health and social care providers, right? Adult social care services are provided by a variety of organizations, including resident care home, um, home care agencies, and nursing home. Okay, we discussed about these already. That we have residential care homes, and we have care agencies, and we have nursing home, and service user can access these services through direct referral from healthcare professional, social worker, or by self referral. So we discuss these. Now, in the next slide, uh, we need to discuss about the voluntary and charitable organization, and that again, voluntary and charitable organizations often play a complementary role in providing adult social care services. These organizations may offer a specialized service. Again, for example, if a person need, just for example, counseling sessions, when the voluntary and the charitable organization can arrange those for us. Uh, with the private provider, for example, the private providers would always we need to pay them again, whether it's from our own pocket or from a local authority if we request them, and if we are eligible, then maybe the local authority would pay some part of that amount, or even some people contact the charity organization and voluntary or charitable organization, then they also support with the individual. I have worked with a charity. I worked with 3 4 charities in the past, and like we used to help them, the service user, in terms of educational support, their private personal matters, and few of the bits like that. So there are some of those organizations which support us for private care as well. So we individually hire, like for example, in counseling session, we have those counselors with us, and the charity organization pay them directly, and that would the private counselor would work with the service user, but actually the charity organization paying the counselor. So this is related with that. Right, again, we have that now to conclude it. So, uh, as access to adult social care services may vary depending on the factors such as geographical location, individual need, eligibility criteria, and funding arrangement. It's important for service users and their families to be aware of the range of options available to seek advice and support from relevant professionals when assessing care services. So then in the slide, we need to analyze the roles related to adult social care. Okay, this is again important. So when we are analyzing the roles related to adults and social care, that involve understanding the diverse responsibility and contribution of individual working with this sector. So here they have mentioned some of the key roles, like for example, social workers. So, what are social workers? Social workers play a crucial role in adult social care, assessing the needs of individual and families, and they developing in the help. They develop they develop the care plan and coordinating support services. They provide advocacy, counseling, and practical assistance to help service users achieve the goals and improve their quality of life. Like in the United Kingdom, uh, social worker, or the term social worker, is a protected term. Like in different countries, like in other countries, what happened is people call themselves as the social worker, those who are helping people with different social matters, or like any sort of help they are providing them. Then the people call them as social workers. So they are working for the betterment of the people. So they are social worker. But especially in the United Kingdom, um, and this term is protected. So like we cannot say that we are social workers, so we need to do the um, qualification and then get registered with the social work England. Previously we have HCPC, and now we have that social work England. So those who are qualified and trained into that field, and those who are registered with the social work England, those are called as a social worker. uh, then we have the care managers. So, for example, the care managers and the coordinators. So, care managers or coordinator oversees the delivery of care service to individual receiving support. They assess care needs, develop care plan, and coordinate care provision and monitor service quality. Care managers liaise with service users, their families, care providers, and other professionals to ensure effective care delivery. Um, it's true, like I have worked in care homes as well, a nursing home and a care home as well. What happened is like uh, as a healthcare assistant, we generally not deal with the service user family. The managers, they have the meetings most of the time with them, and the manager or the management, they provide us the care plan. And again, it's based on the need assessment of the client. Then the care plan they will make, and then as a healthcare assistant or provider, like then we will work upon the care plan given to us. So usually it's the responsibility of the manager to um, talk with the family members, or like any concern or anything like that. But if, for example, in terms of safeguarding, so it's in terms of safeguarding, it's not only the responsibility of the mm, manager, it's the responsibility of every individual, including the service user as well. If they lack the capacity, for example, according to Mental Capacity Act, they lack the capacity to make some decision on their own. So then we take care of it, and in the best interest of the service user. So then, okay, we discuss about the care assistant support workers. So as like mostly we will be working as a care assistant or support worker. So we provide direct care and support to individual in various settings, which include care home, day center, and even in the own home of the service user. So we do the domiciliary care as well. And sometime like in the slide, they have mentioned few of the things like medication administration. So there is a course as a care worker, as you all have worked in the industry, so you know that we do that medical administration course, and then we do the meal preparation and companionship sort of training. And like we also, the care assistant or support worker, they also provide emotional support, and also to encouragement to promote independence and well-being. Then we have nurses. So nurses are in hospitals as well, and they are in the care homes. They are in the nursing home as well. Usually, a nursing home has a nurse available in shift. They work mostly, and like usually in nursing home, we must have one nurse, duty nurse, on in the care setting. And generally with the other care homes, they may not have the nurses available 24/7. um, but like what nurses do here is they mention that nurses working in adult social care setting provide nursing care to individuals with complex medical needs, and they assess the health condition, administer medication as well. Usually in the nursing homes, they do that, but most of us are working in the care industry, in the care home. So usually we administer the medication and things. So that's why we have to do the specific course related with the medical administration or anything like with personal care. So that's why we do the CPD courses or trainings we do to have the knowledge. And then we have that activities coordination and the therapist, activities coordinators and the therapist, right? I gave the example of physiotherapist as well. So for example, we have activities coordinators and therapists. So what they do is facilitate recreation activities, social event, and therapeutic intervention to promote the well-being and engagement of service user. Right. So again, in the care home setting or in the health and social care environment, we have those therapists. For example, we have a physiotherapist. We may have um, uh, a person who's like a yoga instructor or something like that. It depends upon the care home and the requirements of the service user. So there might be some yoga therapist or physiotherapist or any osteotherapy qualified person would be there, and they may help the service user in dealing with their daily life routine and improving their quality of life. So then in the next point, they are discussing about the home care managers or supervisor. So again, we discussed the role of the manager or care supervisor before. So home care managers or supervisor oversees the delivery of home care services, and what their duty is to they ensure that the quality of service is provided to the service user. And usually a manager or the supervisor, they recruit, train, and supervise care staff. And okay, they mention about the risk assessment. So risk assessment is again very important in the health and social care industry. We always do the risk assessment, and we follow the plan according to that. If a person, for example, have mm, allergy to some nuts, for example, with almonds. So we need to take the precautionary step, and we need to follow the risk assessment. So these are the important bits. And registered managers. Okay, again, in United Kingdom, we have the term registered managers, and registered managers are responsible for the overall management operation of care facilities such as residential care home or nursing home. Again, in the United Kingdom, it's a protected term, so not everyone would call themselves, even though if at a facility, if someone is saying that in the other countries that they may have anyone who have the qualification, for example, in accounts and finance, they could be the manager of that care home or any health and social care provision. They call them as registered manager. They call themselves as manager, but like in United Kingdom, the managers, they have the qualification, related qualification, and then they call themselves as a registered managers. Not every individual who has a bit of qualification, like for example, if my uncle has a care home, then he cannot make me a registered manager. So this is a protected term again in the United Kingdom. Then in conclusion, like we understanding the roles related to adult and social care helps to appreciate the interdisciplinary nature of care provision. So the multidisciplinary, interdisciplinary These are the terms we use when different professionals work together to help the service user. So we may have that specific unit related with the interdisciplinary or multidisciplinary team working. Now in that slide, they are asking, assess how the National Organization of Health and Social Care meets national health and social care priorities and impacts on providers. So we will assess how the National Organization of Health and Social Care in the UK meets national priorities and impacts provider. So for example, uh, NHS, National Health Services. So the NHS is structured to provide comprehensive healthcare services free at the point of use, and it aims to meet priorities like reducing waiting time, improving access to care, and enhancing patient outcomes. Then adult social care, generally it's organized by the local authorities, and social care services aim to meet priorities such as supporting individual living and supporting independent living, providing quality care for the elderly, and supporting those with disabilities. So there are a few kinds of disabilities. It's not always like physical in nature. Uh, there are psychological abuses or anything like that, emotional abuses. So we need to look for those and provide support. Then we have integration of health and social care, and which include efforts like the Better Care Fund, and which integrate health and social care services, and like they usually work in reducing hospital admission and promoting community-based care. Then what would be the impact on providers? For example, funding. And national priorities often influence funding allocation, impacting providers' ability to deliver service. And then regulation. Regulation is important. Uh, each and every provider must adhere to the national standards and regulation, which impact their operation and focus. And then we can say that uh, like how does the NHS structure support national health priorities? So the NHS structure is designed to provide accessible, comprehensive healthcare services, and it's free for the residents of United Kingdom. And if we say that, what is the impact of funding? So again, funding impacts providers' ability to offer services and maintain quality and meet the needs of service user.
Yeah.
Then we are next slide. We have alignment with national priorities. Okay, so here we have three bullet points. For example, in that one, we can say that reflecting national priorities and improving population health. So in the United Kingdom, the initiatives like public health campaigns and vaccination program aim to improve overall health and prevent disease. Then we may say that reducing health inequalities, and that involve policies focusing on ensuring equitable access to care, addressing social determinants of health, and targeting unserved communities. Then how to mute your mic. Mute your mic. Can you please mute your mic? Um,
How many minutes? How many minutes?
Right. So now aligning with national policies and uh, we have then in that slide we can say that primary, secondary, and community care as well. We can discuss about that and the structure of health of the healthcare system support integration through initiatives like integrated care system, which bring together provider across setting to coordinate care. Like the multidisciplinary team and interdisciplinary team, like that. Then we would uh, check the effectiveness as well and what it does that it improves the quality of service providing and what are the challenges in that. For example, alignment with the national priorities. So we have aging population in United Kingdom, so there are some policies which focus on expanding elderly care service and supporting aging in place and addressing age related health issues, then mental health issues. So we may say that increased funding and initiatives for mental health services aim to improve access and reduce stigma. Then, for example, impact of infectious disease. For example, we had that COVID-19 pandemic, and that has led to the implementation of emergency response and investment in public health infrastructure and a focus on pandemic preparedness. Then, if we say that how would the public health campaigns contribute to improving population? So there are different campaigns which are done by the government or again with this private or the voluntary organization as well. For example, in those campaign, what they do is they raise awareness to promote healthy behaviors and prevent disease, contributing to overall population health. For example, stop smoking uh, campaigns like that, um, educational or health initiatives we can take in the local community as well. And then we may ask that why is the integration of primary, secondary, and community care is important. So again, it is really important that all those sectors, all those primary, secondary, and community care work together as a team to serve the service user better. And now we have next impact on service providers. So uh, yes, we discuss about the impact. So like for example, if the primary, secondary, and community care work together, then it improves the service user health and whether it's related with any medical condition or social welfare. So it all work together, and that has a positive impact if the service on the service provider and the service user as well. Then, uh, so here in that uh, need to analyze how the organization of health and social care influences provider across different sectors. So for example, if we discuss about the statutory sector, so the government funded services like NHS are influenced by public funding levels and national health policies and regulatory standards. Then we have the voluntary sector, the private sector. Uh, we discuss about those, and then what are the impacts of funding allocation. So equity and targeting as well, we can say that in that slide. uh, then we need to follow the frameworks and quality standard. So like for example, delivery of care. um, regulation and standard that ensures that care which is provided by the um, care provider, so it's safe and it has quality. Then the important bit in that is we have a regulatory body which check us. Like for example, we have the Care Quality Commission. We call it as CQC. So in the United Kingdom, we follow the standards and promote improvements in service quality. CQC monitors a care home or any service related with the health and social care industry. And one more important bit is training. So the training is important for the service provider, like the staff. They should be trained, as we discussed earlier. That, for example, food preparation or medicine administration course we do, and then we have these in that one. And we have next addressing health and social care needs. So in that, we need to evaluate how the organization of health and social care addresses the diverse need of population. And for example, uh, we can say that the demographic changes, for example, the aging population and changing demographic require adaptable services to meet evolving needs of the service user. We cannot have the same service for every individual. It should be focused on the individual. So we have those individual assessment, and the care plan is made according to the individual need. Then we will like it's our duty to like check for if there's any health inequalities. So services must adhere, and they must check that is there any inequality. uh, like we always follow the Equality Act. uh, then we have barriers to access, like some factors like location, language, and cultural sensitivity, religious point of view that may assess the affect the access to care. So we need to consider these things as well. Then right, okay. One more important thing in that mostly we follow the holistic approaches, and that what is a holistic approach mean in health and social care industry? Like we always look for the physical, mental, emotional, and sometimes we refer as the uh, physical, mental, emotional, spiritual health of a person as well. So we always try to work holistically for the betterment of a service user. And what we have next? Okay, so in conclusion, uh, this is the conclusion. Overall, the assessment should provide insight into the strength and weakness of the national organization, health and social care in meeting national priorities. And like we have discussed about the person-centered care to the population, and we discuss about the improvement which are required, and if, to enhance the effectiveness, efficiency, and equity of the healthcare system. We have the references. Okay, so in the end, like I can say that overall, like the National Organization of Health and Social Care in the UK has many strengths, and there are like there are areas areas that require attention to ensure that the system remain effective, efficient, and equitable. And by addressing these areas for improvement, policymakers can enhance the quality and accessibility of care for all citizens. So now we have the references here in the end. So the references the references are where the information in the slides we have taken from, and then the preliminary. Right. Okay. So this is the end of the slide. So what we did today is we going to conclude today's lecture, and I would like to thank you all. Uh, and if you have any question, then please uh, ask me, and I'm happy to answer those as well. And because we have covered a lot of things today, and what we did is we analyzed the strengths and weaknesses of National Organization of Health and Social Care, and identifying also areas for improvement. We discussed that, and what I normally encourage my student to reflect. What is reflection? Reflection is again different with every individual. Uh, we may have the same slides, but every individual would get something different, maybe from the same slide. And if we have the habit to reflect on things, then it would be better for us. Then we will have the habit to memorize things and write it in our own words. So I will encourage all of you to do the reflection as well. And again, the world of health and social care is dynamic and is ever evolving, and your critical thinking and adaptability will be the key asset in navigating it. And we always try to think critically and do the reflection. So again, we'll finish today's sector then, and if you have any further question, or you can ask any question. No. Okay. So then we will finish today's lesson, today's lecture, and I thank you uh, to all of you for the engagement today, and I look forward to our next session. Take care. Thank you. Bye.
Thank you. Bye bye.
Bye.